Mezigdomide is a very powerful CELMoD or degrader which targets the cereblon E3 ligase complex and causes complete closure of the complex. By doing that, there is tremendous degradation of Ikaros and Aiolos, which are these key transcription factors that are fundamental to myeloma pathobiology, but also take the brakes off the immune system. So what we see is both an effect on the myeloma and at the same time a tremendous effect on the immune system. So it activates the immune system against the myeloma. The combination approach of mezigdomide plus dexamethasone we published in the New England Journal in September of 2023 of last year, combined by an editorial from Dr. Schott, which explains some of the science behind it. In our study, we showed an encouraging response rate in triple-class refractory patients with just an oral therapy, basically 41% in a very sizable trial. Moreover, we showed that patients with extramedullary disease enjoyed a 30% response rate, even just as I say, with an oral therapy. And finally, in a subgroup of patients who had been BCMA exposed or were refractory to BCMA therapy, we showed a response rate of 50%. So we're very pleased with this. And these responses did appear durable, and the progression-free survival for an early phase doublet study were quite respectable. What we're very excited about is if you then add further agents to mezigdomide, it really enhances the clinical benefit. And we've seen that with proteasome inhibitors, and then most recently, we've been presenting data on the combination with antibodies, where we've seen dramatic increases in response rate and durability of disease control. This is data we presented at ASH last year, and my colleague, Dr. Albert Oriol, will be presenting this at EHA this coming meeting. And what we see here is the rationale for putting mezigdomide with other immune therapies, such as teclistamab perhaps, or bispecifics of whichever choice, and indeed integrating it into the management of CAR T therapy, because when you see this tremendous impact on immunotherapeutic platforms that is beneficial, I think that bodes well for the future of mezigdomide as a complementary oral agent in that setting, as well, frankly, as an oral agent combined with other standard of care agents where we really see benefit in the relapsed refractory setting.